Hi, my name is Dr. Chen Yiming. Welcome back to my channel where weekly medical informative video is uploaded every week. Due to the COVID-19 situation, many of us over the world are working from home. Working from home entails long hours of sitting at the desk, long hours of calls and online meetings. With that, I'm also seeing an increase in patients coming in with complaints of headaches, neck aches, shoulder strains and lower back pain. In this video, I'll be sharing with you guys 4 simple tips to prevent lower back pain when sitting all day. And if you are new to my channel, click on the subscribe button now. Now before I begin this video, a quick shout out to APOL Singapore, APOL. Now this comfortable ergonomical chair that I'm sitting on is sold on their website. Click on the link in my description box to access the selections. You can also click on the link on the top right of your screen now to access the site. Okay, so tip number 1, avoid sitting too long. There's a lot more pressure on your lumbar disc when you are sitting compared to standing. In general, stand up and stretch your back every 30 to 60 minutes. These are 3 simple stretches that I do myself all the time. The first stretch, keep shoulder width apart. Bend down and touch your toes. Keep your knees as straight as possible. The second stretch, bring both hands up, tiptoe and push up as much as you can and inhale as deeply as possible. Then relax yourself and exhale. The third stretch, put your hands on your waist with the thumb behind the lumbar muscle at the belt level. Gently thrust your hip forward and press the thumb into the back muscles. Repeat this 3 sets of exercises about 10 to 15 times for each movement, every 1 to 2 hours or so. From time to time, lie down if you can after sitting down in a chair for periods of time. I personally like this small little trick. Lie down on the floor with your legs on an elevated platform like this. It's very comfortable. Try it. It helps to alleviate all the pressure building up in your lumbar area. Second tip, stand at your desk if possible. There are lots of seat to stand tables nowadays that allows for flexible height adjustments. The one I'm standing at is a fixed standing table. They can help in reducing back pain. I would generally suggest alternating between the standing and sitting position at intervals of an hour and try to keep a good standing posture with your weight distributed evenly on both feet, heads up, shoulders straight and chest forward. Third tip, when you sit, try to keep a good posture and take note of these few points. Keep your monitor at eye level or slightly below eye level. This keeps your cervical and lumbar spine at the correct position. You can use a monitor stand like this or a laptop stand like this. This also means that you will need a set of wireless keyboard and mouse, and many of them available online. Good lumbar support. Our lumbar spine has a normal curvature. We can reduce back pain by maintaining that curvature when you are sitting. You can roll up a towel or use a small pillow. Alternatively, you can get an ergonomic chair with a lumbar pillow like that of APOL's. It maintains the lumbar curvature nicely and is really comfortable. Keep your elbow at 90 degrees, and this is achieved by lowering the tabletop to your elbow level and the elbow support of your chair to the same level. APOL chairs has armrests that allows for height adjustment to suit different heights. Not many office chairs has this specific function. Next, try to keep your hip and knees at 90 degrees. Sit all the way to the back of your chair. Allow the knees and hips to achieve the 90-90 position, as this is the best for the back and hip. I don't have long legs, so I have personally tried many chairs that have too long a seat that prevents me from bending my knees 90 degrees. When you buy a chair, do take note of that. This APOL Kraken chair fits me really well. Keep both feet flat on the floor. Do not cross your legs as it may cause an unbalanced stress on your lower back, and if your feet is short, you can then use a stool or a pillow to support your legs. APOL has feet support like this so that I can maintain a 90-90 position and still keep my feet flat on the pillow. Yes, the reclined position is not a bad position to be in for temporary relief of stress on your lumbar spine. It's almost like lying down where the pressure of the entire upper half of your body is reduced on the lumbar spine. This APOL chair has an almost full recline. Check this out. Fourth tip, strengthen your back. Strengthen the back and core muscles. As mentioned in my previous video on lower back pain causes in exercise, when you strengthen your back and core muscles, the support on the spine is very much improved. So now Alvin will show you some exercises to strengthen your core and back muscles.
Hi everyone, it is Coach Alvin again. In the previous episode, we spoke about some back stretching exercises. In this episode, we will be demonstrating some back exercises that are aimed to strengthen your core muscles, namely your back and your abdominals. Some of these exercises that we will be executing will actually be done with this, what we call a resistant band. Click the link to get to know where to buy good quality resistant bands. Alright, let's dive into the exercises now. So for the first exercise is what we call good morning. Firstly, stand straight, back straight, look forward, toes pointing forward, shoulder width apart. Right, put your hands over your head as such and bow forward. Notice that when I'm bowing forward, I will slightly bend my knees and I'll come to an upright position again before bowing forward again. Carry out this exercise for about 10 to 20 repetitions, 3 to 4 sets. The next exercise is the squat, bend and reach. So this is a combination of a few movements, so do take note. Similarly, look forward, back straight, toes pointing forward, shoulder width apart. Now this time round, put your hands in front of you like so. For the first movement, is just to do a bodyweight squat, back straight as you go down, butts sticking out. Come up, and you bend forward touching your toes in the second movement, and you come up again. Then you repeat the motion, squat, and toes touching, and squat, and toes touching. Right. Repeat this for about similarly 10 to 20 repetitions, 3 to 5 sets. Third exercise is what we call the band-aid lift. Firstly, take your resistant band, split it into half, and step over it, like so. Toes pointing forward. Instead of holding on to the handles, try to reach for the part of the tubing that is closer to your feet. Stand up straight while holding on to the resistant band tubes. Keep the tubes taut, look forward, and what you're going to do next is you're going to bend forward, knees slightly bent, and you come up again. Notice that my hands are still gripped very tightly to the resistant band tube. Don't let them slide through your hands. And repeat this motion for about 10 to 20 repetitions, 3 to 5 sets. The fourth exercise is what we call the band squats. Firstly, split the bands into half like so. Step over the bands. Raise the handles of the bands to your shoulder in this position, with the bands behind your arm. Keep holding on to this position, toes pointing forward, back straight, and you do a squat. And up, and down, and up. Repeat this movement for about 10 to 20 repetitions, 3 to 5 sets. The last exercise is to be done lying down on the ground and is called the bridges. Right, so firstly, lie down flat on the ground with your feet firmly flat on the ground like so, knees bent. Right, so the movement is for you to thrust your pelvis forward until your back becomes straight. keep your hands by your side, and you go down again. Let your buttocks touch the ground before coming up again. Same thing, repeat this movement for about 10 to 20 repetitions, 3 to 5 sets.
Thanks for watching this video till the end. Hope these points are helpful and the products I shared with you will help you in reducing your back pain when working from home. Subscribe, like and share this video. Till the next time, stay safe, stay healthy.